Have you ever looked at your kidney test results and felt worried after seeing your creatinine level go up? Maybe your doctor told you to watch your kidneys, but the appointment ended before you could ask the most important question: what should I actually eat every day? That happens to many people over 60. Doctor visits are often short. They focus on test results, prescriptions, and the next appointment. There is not always enough time to talk about simple food choices that can support your kidneys every single day. The good news is that small changes can make a real difference. No food can magically cure kidney disease or erase years of damage. Anyone who promises that is not being honest. But the right foods may help reduce the amount of work your kidneys have to do. And when your kidneys are under less stress, they may continue doing their job more effectively over time. Today, you're going to discover 5 everyday snacks that are easy to find in most grocery stores. These are not expensive health products or trendy superfoods. They are simple foods that fit into normal daily life. More importantly, you'll learn why they may be helpful, how to prepare them the right way, and which common mistakes could cancel out their benefits. If you've been told you have chronic kidney disease, stage 3 kidney disease, or your creatinine level has been slowly rising, this information is especially for you. Even if your kidneys are only beginning to show signs of stress, learning about smarter food choices today may help you build healthier habits for the future. Before we talk about the snacks, it's important to understand one simple idea. Once you know this, everything else in today's video will make much more sense. Creatinine is a natural waste product that your body makes every day. Your muscles create it as they use energy during normal activities like walking, climbing stairs, or even standing up from a chair. Your kidneys act like the body's cleaning system. They filter creatinine out of your blood and remove it through your urine. Healthy kidneys do this job quietly every minute of every day. But when the tiny filters inside the kidneys become damaged, they cannot clean the blood as efficiently. As a result, creatinine begins to build up in the bloodstream, and your blood test shows a higher number. Many people believe that once creatinine rises, there is nothing they can do. That is not completely true. While food cannot reverse kidney disease, your daily eating habits can affect how much extra work your kidneys must do. Some foods create more waste for your kidneys to filter. Others provide nutrients that support overall kidney and blood vessel health. The goal is not to perform a miracle. The goal is to help your kidneys work a little easier every single day. Think about it this way. If someone is already carrying a heavy backpack, adding more weight only makes the journey harder. But if you remove a few pounds from that backpack, every step becomes a little easier. Your kidneys work in a similar way. Reducing unnecessary strain may help them continue doing their job for longer. Throughout this video, every snack we discuss follows the same basic idea. It either helps reduce the workload on your kidneys or supports the healthy blood vessels and tissues that your kidneys depend on. That is the simple strategy behind every recommendation you'll hear today. Let's begin with the first snack, and it surprises many people. Snack number 1. Fresh red grapes. Many people avoid grapes because they worry about natural sugar. But when eaten in sensible portions, fresh red grapes can be a smart choice for many older adults living with kidney disease. Red grapes contain natural plant compounds called antioxidants. These compounds help protect your body's cells from oxidative stress, which is a type of damage that can build up over time. Oxidative stress has been linked to many long-term health problems, including kidney disease. The colorful skin of red grapes contains even more of these protective compounds. That is one reason red grapes are often a better choice than peeled fruit or fruit juice. Eating the whole fruit also gives you fibre, which helps slow down how quickly the natural sugars enter your bloodstream. Another reason many kidney specialists include grapes on kidney-friendly food lists is that they are generally lower in potassium than several other popular fruits. This can be helpful for some people whose kidneys have difficulty managing potassium levels. However, potassium needs vary from person to person, so always follow the advice of your own healthcare provider. The best way to enjoy grapes is simple. Wash them well and eat about half a cup as a snack between meals. You can also pair them with a small serving of a kidney-friendly protein if your doctor or dietitian says it fits your meal plan. This combination may help you stay full longer and reduce large swings in blood sugar. There are also 2 mistakes you should avoid. First, don't replace fresh grapes with grape juice. Juice removes most of the fibre and often delivers much more sugar in a much smaller serving. Second, be careful with raisins. Because they are dried, the nutrients become concentrated, including minerals that some people with kidney disease need to limit. Fresh red grapes remain the better choice for most people. And that's only the first snack. The next one may surprise you even more because it challenges one of the biggest myths people hear about eating protein after 60. The second snack is one that many people misunderstand. Some believe that anyone with kidney problems should avoid protein. Others think eating more protein is always better. The truth is somewhere in the middle. Your body needs protein every day. It helps keep your muscles strong, supports healing, and gives your body the building blocks it needs to stay healthy. This becomes even more important after the age of 60 because muscle loss happens naturally as we get older. But there is another side to the story. When your body digests protein, it creates waste products. Healthy kidneys remove these wastes without much trouble. If your kidneys are already under stress, too much protein can make them work harder. That doesn't mean you should stop eating protein. It means choosing the right kind and eating the right amount. One of the best choices for many people with kidney disease is egg whites. Egg whites contain high-quality protein that your body can use very efficiently. They also contain very little phosphorus compared to whole eggs. This matters because damaged kidneys often struggle to remove extra phosphorus from the blood. When phosphorus builds up, it can weaken bones and affect blood vessels over time. That's why many kidney-friendly meal plans recommend egg whites instead of whole eggs for some patients. A simple snack can be made by scrambling 3 egg whites with a little olive oil. Add fresh parsley, chives, or black pepper for flavor instead of extra salt. You can also boil whole eggs and remove the yolks if you prefer. If you buy liquid egg whites from the supermarket, take a quick look at the nutrition label. Some brands add extra sodium. Choosing a lower sodium option is usually the better choice. There is another mistake people often make. Some people eat only 1 egg white and think that is enough protein. In reality, 1 egg white contains only a small amount. 3 or 4 egg whites provide a more satisfying snack while still giving your body quality protein. Of course, everyone is different. People with advanced kidney disease may need a personalized protein plan from their kidney specialist or renal dietitian. Always follow the advice that matches your own health condition. Now let's move to the third snack. This one surprises almost everyone because many people believe it should never be on a kidney-friendly menu. The answer is potatoes. Yes, potatoes. Most people have heard that potatoes contain a lot of potassium. That is true. High potassium can become a problem for people with reduced kidney function. But very few people know there is a simple preparation method that can lower a significant amount of the potato's potassium before you even eat it. The secret is soaking and boiling. After peeling the potatoes, slice them into thin pieces. Place them in warm water for several hours. Changing the water once during the soaking time can help remove even more potassium. Then rinse the slices and cook them in fresh water without adding salt. This method cannot remove all the potassium, but it can reduce enough that, for some people with stage 3 kidney disease, potatoes may fit into a balanced eating plan when approved by their healthcare provider. This is why preparation matters just as much as the food itself. Many people give up foods they enjoy because they think they have no choice. But learning the correct cooking methods may allow them to enjoy some favorite foods in smaller, safer portions. A small serving of mashed potatoes made with olive oil, fresh herbs, and a little lemon juice can be both comforting and satisfying. The key is portion size. Eating a huge plate of potatoes is very different from enjoying half a cup as part of a balanced meal. There are also 2 common mistakes. The first is using the microwave instead of soaking and boiling. Microwaving cooks the potato, but it does not remove potassium. If reducing potassium is your goal, soaking and boiling remain important. The second mistake is assuming sweet potatoes are automatically the healthier choice for everyone. For many healthy adults, sweet potatoes are a great food. But for people who need to control potassium, they may not always be the better option. Every person's kidney condition is different, so the safest choice depends on your doctor's advice and your latest blood test results. One important lesson connects all 3 snacks we've discussed so far. Kidney-friendly eating is not about finding one magical food. It is about making smart choices again and again. Small changes may seem unimportant on a single day, but over weeks and months, those choices become habits. And healthy habits are what give your kidneys the best chance to keep working well for as long as possible. We've covered fresh red grapes, egg whites, and properly prepared potatoes. The final 2 snacks may be even more surprising because they offer benefits that many people never connect with kidney health. Those are coming up next. Now let's look at the 4th snack. It is one of the easiest foods to add to your weekly shopping list, yet many people never realize how helpful it can be for overall kidney health. Cauliflower may not seem exciting, but it offers several benefits for older adults trying to protect their kidneys. First, it is naturally low in sodium. It is also lower in potassium than many other vegetables. That makes it a practical choice for many people following a kidney-friendly eating plan. But there is more to cauliflower than just its nutrition label. It belongs to a family of vegetables known as cruciferous vegetables. This group also includes broccoli, cabbage, and Brussels sprouts. These vegetables contain natural plant compounds that help support the body's normal defense system against inflammation. Why does that matter? Long-term inflammation can slowly damage blood vessels and body tissues. Healthy blood vessels are important because they deliver oxygen and nutrients to every organ, including your kidneys. Although cauliflower is not a treatment for kidney disease, eating more vegetables like this as part of a balanced diet may support overall health and fit well into many kidney-friendly meal plans. It is also rich in fibre. Fibre helps support healthy digestion and may help you feel full for longer. That makes it easier to avoid processed snacks that often contain large amounts of salt, unhealthy fats, and food additives. Preparing cauliflower is simple. One popular option is cauliflower rice. Just grate or pulse fresh cauliflower into small pieces and lightly cook it with olive oil, garlic, herbs, and a squeeze of lemon. You can also roast cauliflower in the oven until the edges turn golden brown. It becomes soft, slightly sweet, and full of flavor without needing extra salt. The biggest mistake is buying frozen cauliflower covered in creamy sauces or cheese. These products often contain much more sodium and phosphate additives than plain cauliflower. Reading the nutrition label before buying packaged foods is always a smart habit, especially if you are managing kidney disease. Now let's move to the fifth and final snack. This one surprises many people: macadamia nuts. Many people hear that nuts should be avoided because they contain phosphorus and potassium. While some nuts are quite high in these minerals, not all nuts are the same. Macadamia nuts are naturally lower in potassium and phosphorus than many popular nuts, such as almonds or peanuts. They are also rich in healthy monounsaturated fats. These are the same heart-friendly fats found in extra virgin olive oil. You may wonder what heart health has to do with your kidneys. The answer is simple. Your kidneys depend on healthy blood flow. Tiny blood vessels deliver oxygen and nutrients to the millions of small filters inside your kidneys. When blood vessels stay healthier, your kidneys are better supported as they perform their daily work. Macadamia nuts also make a satisfying snack. Their healthy fat helps you feel full, making it easier to avoid highly processed snacks that are often loaded with salt and unhealthy ingredients. The key, however, is moderation. Macadamia nuts are high in calories. A small handful, around 10 to 12 nuts, is usually enough for one serving. Choose raw or dry roasted varieties without added salt whenever possible. Stay away from sweet coatings, chocolate-covered nuts, or heavily flavored versions. These often contain extra sugar, sodium, and additives that offer little nutritional value. One simple snack idea is to enjoy a few fresh red grapes together with a small handful of unsalted macadamia nuts. It is easy to prepare and fits well into many balanced eating plans. Now that we've covered all 5 snacks, let's step back and look at the bigger picture. Many people believe kidney health depends on finding one miracle food. It doesn't. There is no single fruit, vegetable, or snack that can repair damaged kidneys overnight. Real progress comes from consistent daily habits. Every healthy choice you make may help reduce unnecessary stress on your kidneys while supporting your overall health. Think of these snacks as part of a complete lifestyle. Regular medical checkups, taking your prescribed medicines, managing blood pressure, keeping blood sugar under control if you have diabetes, drinking the amount of fluid recommended by your healthcare provider, staying physically active, and making smarter food choices every day. These habits work together. One healthy meal will not change your life, but hundreds of healthy meals over months and years can make a meaningful difference. If your creatinine level has been increasing, don't panic. That number is one piece of information. It helps your doctor understand how well your kidneys are working, but it does not tell the whole story. Your daily habits still matter. The foods you choose today can support your health tomorrow. Before making major changes to your diet, especially if you have stage 4 or stage 5 kidney disease, speak with your kidney specialist or a registered renal dietitian. Everyone's kidney function is different. Some people need stricter limits on protein, potassium, phosphorus, or fluids. The safest eating plan is one that matches your own medical needs and blood test results. So, What should you do after watching this video? Keep it simple. Write down these 5 snacks before your next grocery trip. Fresh red grapes, egg whites, properly prepared potatoes, cauliflower, unsalted macadamia nuts. You don't need to change everything in one day. Start with just one healthy swap this week. Once that becomes part of your routine, add another. Small improvements are much easier to maintain than trying to change your entire lifestyle overnight. Remember, protecting your kidneys is not about being perfect. It is about making better choices more often. Your kidneys work for you every minute of every day without taking a break. Supporting them through healthy habits is one of the best investments you can make in your future health. Thank you for spending these minutes learning how simple food choices can support your kidney health. If you found this information helpful, share it with someone who may benefit from it as well. Take care of yourself, stay informed, and keep giving your kidneys the support they deserve.